So what causes hair loss? Specifically, what causes hair loss in a woman? We're going to talk about different categories or different reasons for this in females. Five different main topics that we're going to cover as far as causes for hair loss in a woman. They're not always gender specific, but we're going to focus mainly on causes that it relates to a woman as she's aging through her life, some things that may come up, so you can sort of target where you're at and what you might want to look into a little bit further. What we're not discussing here is a specific type of hair loss called alopecia areata, where we're talking about more diffuse hair loss. Alopecia areata is more circular type of hair loss. So not talking about that here. That's more of an autoimmune thing, a little too specific for this video. So maybe in another video we will discuss that. But five main things in this video, and first one being iron. So how does iron relate to hair loss? Second one being thyroid. Third one being cell division and nutrient deficiencies. How is that related to hair loss? More basic one, biotin, and then fifth one being hormone related, specifically testosterone. How does that relate to hair loss? So we're going to discuss all of these in more detail in just a second. Just wanted to say, if you do have questions about any of the content of the video, please ask them in the comment section. Appreciate you watching the video, and hopefully you enjoy it. Today we're going to talk about hair loss, and specifically we're going to talk about hair loss as it relates to women. What are the causes of hair loss in women, or what are some things that contribute to this or lead to this in general? More specific for women though. So there's five main areas that we're going to talk about. The first one being related to hormones and menopause. So a lot of women start losing their hair, and there can be various scenarios here, but many times we see perimenopausal or postmenopausal women losing their hair, and this likely, not always but very often, is related to their heavy menstrual cycles leading up to menopause. So a lot of times perimenopausal women have higher amounts of estrogen, lower amounts of progesterone. This is called estrogen dominance, and as a result their cycles become much heavier, and they're losing a lot of blood. With that blood, a lot of iron, and so they become anemic, or perhaps they're not anemic, but just deficient in iron. So iron deficiency definitely can lead to some hair loss or not enough hair growth, feeling like your hair is thinning. In fact, a lot of nutrients can do this, and this leads to a second topic, which is cell division. So any cell in your body that's rapidly dividing, you'll start to, when there's nutrient deficiencies, you'll start to see a lag in their production. And with hair is very rapidly dividing cells and requires a lot of DNA support for those cells, those hair follicles to divide, and that requires B12 and folate, lots of other micronutrients too, but mainly B12 and folate are two of the most common reasons as far as nutrients go. So if you're losing blood in addition to losing your iron, you're also potentially losing your B12 and folate. Now typically these are pretty readily available in the diet, but if you are having issues with absorption of them, as with the iron, you may start to see your hair falling out. This would be a more diffuse hair falling out. Little spots of hair loss would be a totally different topic. The third would be related to thyroid. So thyroid, low thyroid is a common cause for hair loss in women and men to a certain extent as well. Thyroid issues, hypothyroidism, more common in females. So this one maybe more associated with postpartum. So after having a child, you may all of a sudden have a thyroid issue. That's not uncommon. And so think about that demographic a little bit, but you can get a thyroid hypothyroidism at any point in your life, before having children, after, not even having children can occur. So hypothyroid, you should get screened for that. And then the last one, or actually the fourth one, a lot of times people will get a hair supplement with biotin in it. Now, biotin, if you're deficient, it will lead to hair loss, but most people are not deficient in it. Is it going to harm you to put a little extra biotin into your system? Probably not. But if it's not working, maybe you need to scratch that and look at some of these other potential issues too. And then the last one being too much testosterone. So just like males lose hair as they age, is often related to their testosterone, or more specifically related to a metabolite of that testosterone called dihydrotestosterone, or oftentimes abbreviated DHT. So if you're getting hormone replacement therapy, women can also get this conversion into dihydrotestosterone. So if you're on really high doses of testosterone, it's not uncommon to get some hair loss with that. So whoever's prescribing it needs to be cognizant of that, and maybe don't push those upper limits too much, especially if that's what you're experiencing. And by the way, by the time that starts to show up, it's usually 3 months into it, and it's hard to rewind that too. So if you're thinking about going on testosterone therapy, make sure you're cognizant that it can lead to that, especially if you're pushing those upper limits, above 100 nanograms, above 100 nanograms per deciliter, I believe it is. I forget the exact units of measure there, but it's around 100 for the total testosterone. Anything above that could potentially cause that, but it won't necessarily for all women. So again, those are the 5 topics. So what are you going to do about this? Basically, you need to get screened for these things. They're not necessarily something that's going to jump out at you on a typical blood screening. Iron, you need to be checking ferritin level. Thyroid, you need to be checking TSH, free T3, potentially some anti-thyroid, anti-TPO. For the cell division / B12 folate type thing. This one's a little trickier to evaluate. You can check serum B12 and serum folate. If those are low, you have an obvious issue there, but oftentimes they're normal, but there's still an issue. So that will take a little bit more finding the right clinician that can evaluate that. You can look at red blood cell folate, you can look at homocysteine, but mainly we want to look at the overall methylation pathway and see, and folate pathway, and see if there's any problems with that. Those may require more advanced testing. And then lastly, testosterone we talked about. Just got to make sure you're not pushing that upper limit too much. Biotin, there's a test for biotin. Typically, we don't run that test. So hopefully that gives you some good information on the causes of hair loss for women. And if you have any questions about the content of the video, please leave them in the comment section. I'd be happy to answer those questions. If you like this video, please subscribe to the channel and hit the like button so we can make more good content for you in similar types of topics.